Welcome to Medical Licentiate Emerson Educational Channel. Precocious puberty. It's a term that can spark anxiety and confusion for parents. Simply put, it means puberty is starting earlier than expected. For girls, this means before the age of 8. For boys, it's before the age of 9. While it might seem like just a slight variation in the timeline of life, precocious puberty requires careful attention. Why the concern? Because puberty is about so much more than just physical changes. It's a complex process involving hormones, growth spurts, and emotional development. When this process begins too early, it can have lasting effects on a child's physical and emotional well-being. Imagine a young girl, barely out of kindergarten, showing signs of breast development, or a boy, not yet in middle school, experiencing his voice deepening. These are just a glimpse into the world of precocious puberty. This condition demands understanding. Parents, caregivers, and medical professionals must work together to navigate the challenges and ensure the best possible outcomes for children experiencing precocious puberty. What triggers this early onset of puberty? The answers are as varied as the children affected. In some cases, the cause remains a mystery. However, we can often trace it back to two main types: central precocious puberty, or CPP, and peripheral precocious puberty, or PPP. CPP, the most common type, originates in the brain. It involves the premature activation of the hypothalamus, a small but powerful gland that regulates hormones. The hypothalamus releases gonadotropin-releasing hormone, or GnRH, which sets off a chain reaction, stimulating the pituitary gland to produce hormones that trigger puberty. PPP, on the other hand, bypasses the brain. It occurs when the ovaries or testes, the gonads or adrenal glands, start producing hormones independently, without the usual signals from the brain. Several factors can contribute to PPP, including tumors, genetic disorders, or certain medications. Understanding the distinction between CPP and PPP is crucial for diagnosis and treatment. It allows medical professionals to pinpoint the root cause and develop a targeted approach to manage the condition effectively. Early detection is key in managing precocious puberty. But how can parents and doctors identify it? The signs often mimic normal puberty, making it tricky to spot. In girls, look out for breast development, pubic or underarm hair, a growth spurt, acne, adult body odor, and vaginal discharge. Boys might experience testicular and penile enlargement, pubic, underarm or facial hair growth, a deepening voice, acne, and increased muscle mass. While these signs can indicate precocious puberty, it's important to remember that every child develops at their own pace. However, certain factors increase the risk of early puberty. Girls, especially African American girls, have a higher likelihood of developing precocious puberty. Obesity also plays a role, as fat cells can produce hormones that influence puberty. Exposure to certain chemicals, such as phthalates found in plastics, has also been linked to early puberty. Additionally, medical conditions like brain tumors, head injuries, or genetic syndromes can contribute to this condition. Left untreated, precocious puberty can have several implications for a child's well-being. One significant concern is their adult height. While they may initially experience a rapid growth spurt, their bones mature and fuse earlier than their peers. This early closure of growth plates can lead to a shorter adult height than they would have otherwise achieved. Beyond physical stature, early puberty can also take a toll on emotional and social development. Navigating the physical and hormonal changes of puberty is challenging enough for teenagers. For children experiencing these changes at a much younger age, the emotional and social impact can be overwhelming. Imagine a young girl starting her period while her classmates are still playing hopscotch, or a boy whose voice is changing before he even reaches middle school. These children might face teasing, bullying, and social isolation. They may also struggle with body image issues, low self-esteem, and even depression. Section 5: Preventive Measures: Navigating the Path of Early Puberty. Can we prevent precocious puberty? The answer, unfortunately, isn't simple. Since the causes are diverse and often unknown, there's no guaranteed way to prevent it entirely. However, we can take steps to mitigate risk factors and promote healthy development. Maintaining a healthy weight through a balanced diet and regular exercise is crucial. Limiting exposure to endocrine-disrupting chemicals found in plastics, pesticides, and certain personal care products is also essential. Early detection and intervention are paramount. Parents and caregivers play a vital role in monitoring their children's development and seeking medical attention if they notice any concerning signs. Section 6. Diagnosis: Unveiling the mystery of precocious puberty. Diagnosing precocious puberty is like piecing together a puzzle. It requires a multifaceted approach that combines a thorough medical history, physical examination, and specialized tests. The journey often begins with a concerned parent or caregiver noticing unusual changes in their child. The doctor will ask detailed questions about the child's medical history, family history of puberty, and any medications they're taking. A physical examination follows where the doctor assesses the child's growth, including height, weight, and body mass index. They will also examine for signs of puberty, such as breast development in girls or testicular enlargement in boys. To confirm the diagnosis, blood tests are crucial. These tests measure hormone levels, providing valuable insights into the child's endocrine system. Imaging tests, such as X-rays of the hand and wrist, can help determine bone age, which can indicate if puberty is progressing too quickly. In some cases, an MRI of the brain might be necessary to rule out any underlying conditions, such as tumors. Section 7. Treatment options, a beacon of hope for precocious puberty. The good news is that precocious puberty is treatable. The goal is twofold: halt or slow down the progression of puberty and address any underlying medical conditions contributing to it. One of the most effective treatments is GnRH analog therapy. This involves regular injections or implants that regulate the release of hormones involved in puberty. By suppressing the hormones driving early puberty, GnRH analogs can slow down or even temporarily halt the process, allowing the child to develop at a more appropriate pace. If an underlying medical condition, such as a tumor, is identified, treating that condition often resolves precocious puberty. For instance, if a tumor is causing the overproduction of hormones, surgically removing the tumor can restore normal hormone balance. The choice of treatment depends on various factors, including the child's age, the severity of their condition, and the underlying cause. The medical team will work closely with the family to determine the most appropriate course of action. Section 8. Coping and support, a guiding hand for families. Navigating the challenges of precocious puberty extends beyond medical treatment. It requires a strong support system and effective coping strategies. Children with this condition might experience a roller coaster of emotions, confusion, fear, anger, and even embarrassment. Parents and caregivers play a crucial role in providing emotional support and reassurance. Openly communicating with the child, answering their questions honestly and age-appropriately, and creating a safe space for them to express their feelings are essential. Seeking professional counseling can be immensely beneficial. A therapist can equip the child with coping mechanisms to manage the emotional and social challenges they might face. Support groups, both online and in person, can connect families with others who understand their journey. Section 9. Preparing for the doctor's visit, your guide to precocious puberty consultation. Walking into a doctor's appointment concerning precocious puberty can feel daunting. Preparation is key to ensuring a productive and informative visit. Before the appointment, jot down any signs of precocious puberty you've observed in your child. Note their age when you first noticed these signs, as well as any changes in their behavior or mood. Gather information about your family's medical history, particularly any instances of early puberty or hormonal conditions. Prepare a list of questions to ask the doctor. Don't hesitate to inquire about the different diagnostic tests, treatment options, potential side effects, and long-term implications of the condition. Remember, you are your child's advocate. Don't be afraid to ask for clarification, express your concerns, and actively participate in the decision-making process regarding your child's care. By understanding precocious puberty, recognizing its signs and seeking timely medical attention, we can provide the best possible care and support for children navigating this complex condition. Thank you for watching Medical Licentiate Emerson channel. Please subscribe and like the